Health in the Philippines, Wikipedia audio. Healthcare in the Philippines varies with private, public, and barangay health centers. Most of the national burden of healthcare is taken up by private health providers. Doctors, nurses, nursing aides, midwives, caregivers, and health administrators can all train for their profession in the Philippines. However, those who migrate to different countries often encounter difficulty practicing outside the Philippines. There is no requirement in the Philippines for causes of death to be medically determined prior to registration of a death, so national statistics as to causes of death in the Philippines cannot be accurately substantiated. In the provinces, especially in places more remote from registries, births and deaths are often not recorded unless some family need arises, such as entry into college. When there is no legal process needed to pass on inheritance, the recording of deaths is viewed as unnecessary by the family. Overview. Large areas of the Philippines do not have daily access to any pharmaceuticals at all. In 2000 the Philippines had about 95,000 physicians, or about 1 per 800 people. In 2001 there were about 1,700 hospitals, of which about 40% were government-run and 60% private, with a total of about 85,000 beds, or about 1 bed per 900 people. The leading causes of morbidity as of 2002 were diarrhea, bronchitis, pneumonia, influenza, hypertension, tuberculosis, heart disease, malaria, chickenpox, and measles. Cardiovascular diseases account for more than 25% of all deaths. According to official estimates, 1,965 cases of human immunodeficiency virus were reported in 2003, of which 636 had developed acquired immune deficiency syndrome. Other estimates state that there may have been as many as 9,400 people living with HIV/AIDS in 2001. Nutrition Foundation of the Philippines, Inc., National Nutrition Council. Expenditures on health in 2002 totaled about $2.2 billion, or about 2.9% of gross domestic product. Government expenditures on health accounted for only about 15% of total health expenditures, 30% of per capita health expenditures, and about 0.9% of all government spending. Per capita health expenditures in 2002 totaled $28, of which government spending accounted for $8. Both total and per capita expenditures on health have continued to decline since at least 1990, leading to a decrease in the share of GDP attributable to health expenditures. The main cause of this decline has been the high population growth rate. The government share of total spending on health also has declined steadily, and with more people, there has been less to spend per person from both the government and private sectors. The proposed national health budget for 2010 is $28 billion, about $597 million, or about 310 pesos per person in the Philippines. Generic medicines in the Philippines are highly competitive versus branded medicines due to the high out-of-pocket expenses in the Philippines in terms of value, even with the 81% coverage of the country's healthcare system. In response to the Millennium Development Goals' focus on maternal and child health, the Philippines began the National Demographic and Health Survey in 1968 to assess the effectiveness of public health programs in the country. Nutrition, medicine, dentistry in the Philippines, history of medicine in the Philippines, medical education in the Philippines.